Poverty is by far the best predictor of somebody's future health status and current health status. The more times you've been in poverty in your life, the shorter your life is likely to be. People have demonstrated a thing called a dose-response relationship between poverty and ill health. So rather like the more cigarettes you smoke, the more ill you're going to be. The more you're poor, the more ill you'll be. There are a huge variety of migrant communities in the UK. Some of the very healthiest communities in the UK are migrant communities, very rich communities in certain parts of London where everybody's a migrant, nobody grew up there. And of course some of the poorest communities and some of the communities suffering the worst health are also migrant communities. So migrant communities span the entire spectrum. The point of the NHS is that it's a universal service. That's how it works. Certain people are charged for many things in the NHS if they're not a citizen of Britain or have the European rights. But other things like accident and emergency, it's incredibly inefficient and actually dangerous to health to start worrying about exactly where somebody comes from when you're trying to treat them. It's just stupid. If migrants aren't included in the health service, then you're going to have a lot of people getting a lot iller and a lot sicker. And eventually those illnesses and sicknesses will have to be dealt with and they'll create problems. You could end up with diseases spreading. For instance, if you don't treat tuberculosis can spread in the population. You'll end up with a lot of health workers being incredibly angry that they're not being allowed to do their job and look after the general health of the population. We're all one population. We aren't a separate population. The idea of a health service is to keep the health of a whole population up, and if you do that, every individual's health is made better. Managers in the health service have a huge problem with dealing with government. One thing I suspect quite a lot of managers do is keep very quiet but make sure that people are still getting health services but not talk about it, in case if they say we're still managing to provide a health service to people, government will say, oh, those aren't the kind of people we want you to provide a health service to, stop doing it. It's not dissimilar to the way the German government began in 1933 and 34 cutting off services to certain people. It may sound extreme to say that, but if people had actually said that at the beginning of what happened in the start of Nazi Germany, you might not have got what happened in the end of Nazi Germany. And there were a lot of people working quietly and a lot of people making a lot more noise, saying you need to treat people as if everybody was a human being and they weren't different kinds of animals.